In this video, you'll get a quick overview of Vibrant's Nutrient Zoomer. I'll start with an overview, including explaining the two panels included in the test. Then, I'll discuss collection instructions and explain the required tubes. Next, I'll walk through each section of the test, highlighting key features. During the test walkthrough, I'll also explain the technology used. We'll discuss factors that can influence nutrient status and why the date of service is critical to interpretation. Finally, I'll suggest synergistic tests and end by highlighting the Vibrant advantage and where to go for additional information. More than 2 billion people suffer from micronutrient deficiency worldwide. Micronutrients like vitamins, minerals, and fatty acids play a vital role in energy production, hemoglobin synthesis, maintenance of bone health, adequate immune function, and protection of the body against oxidative stress and cellular damage. Assessing intra- and extracellular nutrient levels is the only way to objectively determine root causes of malnutrition and inflammation. Specifically, it can help differentiate between dietary and other factors that impair nutrient metabolism or absorption. Vibrant's Nutrient Zoomer provides a comprehensive, clinically actionable assessment of how the body utilizes essential vitamins, minerals, and key nutrient-related biomarkers. Rather than looking at circulating levels alone, the test integrates serum markers with intracellular and functional indicators to uncover deeper nutrient patterns that routine labs often overlook. This dual-layer approach reveals subtle imbalances, impaired utilization, and clinically meaningful ratios that influence energy production, metabolic function, immune resilience, and overall cellular performance. The result is a more complete and precise understanding of nutrient status, allowing you to move beyond deficiency screening and towards targeted physiology-driven intervention. Next, let's walk through the collection process for the Nutrient Zoomer, including how the sample is obtained and the key preparation considerations to ensure accurate results. Vibrant's Nutrient Zoomer is a blood-based test. Blood is collected via venipuncture, performed by a trained phlebotomist. This test requires 6 tubes of blood, which allows us to analyze nutrients across multiple biological compartments. The Nutrient Zoomer includes 2 complementary panels, Nutrient Baseline and Nutrient Intracellular. Each panel evaluates nutrients in different biological compartments, providing a more comprehensive assessment of micronutrient status. The Nutrient Baseline panel measures nutrients in the serum and red blood cells. The Nutrient Intracellular panel measures nutrients inside the white blood cells, including monocytes, eosinophils, basophils, lymphocytes, and neutrophils. By assessing both intracellular and intracellular compartments, we gain insight into both circulating levels and functional cellular status. To assess nutrients across different biological compartments, including trace elements, we collect 6 tubes of blood using 3 specific tube types. Number 1, serum tubes, like the tiger top or red and yellow SST tubes. These tubes do not contain an anticoagulant. Therefore, blood is allowed to clot. Specifically, the red blood cells form a clot at the bottom, and the remaining liquid portion is serum. This serum is used to measure circulating nutrient levels. Number 2, the lavender top EDTA tubes. These tubes contain an anticoagulant, which prevents clotting. After processing, the blood separates into 3 layers, red blood cells at the bottom, plasma at the top, and the buffy coat, a middle layer containing white blood cells and platelets. Using our in-house isolation procedures, we separate red blood cells and white blood cells from these layers to measure intracellular nutrient levels. And number 3, the royal blue metal-free tube. This specialized tube is designed for accurate assessment of trace elements and metals. It is manufactured to be free of metal contaminants, which ensures analytical precision when measuring micronutrients such as zinc, copper, selenium, and other trace minerals. By using these specific collection tubes, we can accurately isolate serum, red blood cells, white blood cells, and trace element samples, allowing for a comprehensive micronutrient assessment. To ensure accurate and clinically meaningful results, patients should schedule their blood draw in the morning. An overnight fast of at least 8 hours is recommended, and patients should avoid food and beverages other than water during this fasting window. However, for clinically relevant interpretation, patients should maintain their usual diet, medications, and supplements in the days leading up to testing, unless otherwise directed by their healthcare provider. As with all laboratory testing, patients should consult with their healthcare provider before making any changes to medications, supplements, or dietary patterns. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Nutrient Zoomer report includes a cover page, an index, introduction, nutrient summary, a list of all the markers, and then ends with the interpretation of all out-of-range markers. The cover page identifies the sample type and includes the results interpretation key. The index lists the 6 sections of the report, including the Nutrient Zoomer summary and the 4 nutrient panels, specifically vitamins, minerals, amino acids, fatty acids, and blood cell count. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. Now let's talk about methodology. Vibrant's Nutrient Zoomer utilizes the gold standard inductively coupled plasma mass spectrometry, abbreviated ICP-MS, for metals and minerals, and liquid chromatography with tandem mass spectrometry methodology, abbreviated LC-MS, for quantitative detection of most other micronutrient markers. These methodologies are powerful analytical techniques that combine the separating power of ICP or LC with the highly sensitive and selective mass analysis capability of triple-quadrupole mass spectrometry. After the introduction comes the Nutrient Zoomer summary. The summary provides concise information on the abnormal serum and cellular analytes via 7 risk scores informed by those out-of-range nutrients. In this example, the patient has increased risk for gastrointestinal barrier, liver detoxification, and neurological, cognitive function and mood based on nutrients that are either too high or too low. These risk scores classify nutrients based on body system or structure function, scoring each on a scale of 1 to 100. Scores of 80 or above are colored green and indicate optimal risk. Scores between 60 and 79 are in orangey yellow, indicating moderate risk, and scores of less than 60 are highlighted red and indicate high risk of experiencing issues and symptoms in that health area due to micronutrient deficiency or overload. In this example, low serum vitamin D and glutamine plus low white blood cell glutamine lower the gastrointestinal barrier risk score from 100 to 76, indicating moderate risk for health issues in this category. In this example, a moderate omega-3 index plus low levels of vitamin E and vitamin K lower the cardiovascular health risk score from 100 to 69, indicating high risk for health issues in this category. While we're exploring the Nutrient Zoomer summary scores, I want to point out that the serum status indicates baseline levels. Meanwhile, the white blood cell and red blood cells indicate intracellular status. Please note that the risk scores assign a different weightage to each micronutrient based on its clinical importance and significance in the body system or structure function for each category, so micronutrients are not scored or weighted evenly. For example, omega-3 index has a higher impact on cardiovascular health than DPA, and glutamine has a higher impact on gastrointestinal barrier than vitamin D. These 7 risk scores are informed by the out-of-range nutrients. The list of out-of-range markers appear at the end of the report along with report comments. The report comments for out-of-range markers include the physiological function of the nutrient, how it gets depleted, clinical manifestations of depletion, food sources, and supplement options. And in between the Nutrient Zoomer summary and the out-of-range markers comes the list of all markers, including fat-soluble vitamins, water-soluble vitamins, minerals, amino acids, fatty acids, and blood cell count. The Nutrient Zoomer measures and reports total white blood cell count, neutrophil count, and lymphocyte count so you can critically interpret results. Normal white blood cell counts are needed to ensure accurate results, as intracellular results are calculated and expressed as a ratio of total white blood cell counts. For example, and let's assume for a minute that all white blood cells have the same number of nutrients, if you have a large number of white blood cells, your sample will inevitably have more nutrients than if you have a small number of white blood cells. However, if your patient's white blood cell counts are out of range, either too high or too low, not all is lost. Low white blood cell counts may falsely concentrate the analytes, resulting in false highs. For example, 2 divided by 10 is 20%. Meanwhile, high white blood cell counts may falsely dilute the analytes, resulting in false lows. For example, 2 divided by 100 is only 2%. When your patient's white blood cell counts are out of range, you can simply shift the values left or right on the graph. Results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. The classification of green denotes a result that is within the reference range, and the classification of red indicates a result that is outside of the reference range. And note that red can indicate deficiency too low or overload too high. When you order a repeat nutrient zoomer on the same patient, current results are indicated by a dark blue pin, and previous results are indicated by a light blue pin. In this example, the patient's serum iron increased from 60.7 to 139, and their red blood cell iron increased from 92.2 to 114.6. Factors that can affect nutrient status include a change in diet or exercise regime, initiating, discontinuing, or a change in dose of medications, including drug-nutrient interactions. Also, initiation, discontinuation, or change in dose of supplements. Also, experiencing a major life event, trauma, or change in stress level. Additionally, infection, malabsorption, kidney disease, and genetic variants can also impact nutrient status. For example, I had a client with normal serum levels of vitamins and minerals, but low levels of intracellular nutrients. After doing a thorough health and diet history, I learned he's a tax accountant who collected his blood sample 1 month after the end of tax season. He told me, "I basically don't eat for the months of March and April." Therefore, it was no surprise his cellular levels were low. It was due to accidental malnutrition. Note the date of service is critical to interpretation. The date of service for this test is May 7, 2025. Serum indicates the past few hours, days, maybe up to 1 week micronutrient status, which is May 1st through May 7th. The white blood cells reflect the past 3 to 4 weeks of micronutrient status, so April 7th through May 7th. Meanwhile, red blood cells reflect the past 3 to 4 months micronutrient status, so February 7th through May 7th. Before I share synergistic tests, I'd like to introduce you to Dr. Sydney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to Vibrant's nutrient zoomer, also consider the gut zoomer, which connects nutrient status to digestion, microbiome balance, and gut barrier integrity, clarifying when malabsorption or inflammation limits nutrient availability. Also, the hormone zoomer, which adds endocrine context, clarifying when nutrient demand shifts with cortisol rhythm, sex hormone metabolism, or chronic stress physiology. Also, the cellular zoomer, which links nutrient sufficiency to downstream cellular performance, showing whether nutrients are supporting energy production, redox balance, and detox demand. And finally, the toxin zoomer, which anchors nutrient depletion to environmental load, helping determine when antioxidant, mineral, or methylation demand reflects detox pressure rather than dietary gaps. In summary, the nutrient zoomer uses gold standard mass spectrometry methodology to measure vitamins, minerals, amino acids, and fatty acids, reframing nutrition assessment from "are levels normal" to "are nutrients reaching cells and meeting demand?" By integrating circulating levels, intracellular status, and functional ratios, it revealed nutrient patterns that routine labs and supplement guesswork often miss. This enables clear differentiation between low intake, poor absorption, and utilization failure, along with more confident supplementation that is targeted but not excessive, and stronger patient conversations grounded in measurable nutrient biology. To learn more, visit the links in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.